Good morning, good afternoon. This is Dr. DeShavo doing a quick review on innate immunity. So, we have multiple ways to fight off infections. And in an overall view, we're going to review innate immunity and an adaptive immunity in a separate lecture. Innate immunity is what we're born with. It's systems that are put into place on the surface of our skin and body, and also along the GI and respiratory tract to fight off immediate response or infections. And it doesn't have strong specificity, but it's immediate, it's pretty strong, and it helps us to fight off those daily factors and infections. Okay. First line of defense. So it's on the surface of our skin, surface of our GI tract, surface of our respiratory tract, and it has white blood cells, a couple different types, that it can create an immediate response if we have any problems, which are generalized inflammation. The skin not only can slough off a lot, we lose a lot of skin cells. I was saying this, our skin cells are in a lot of the dust that we clean up every week, in our houses. But it's true. In addition to that, we have enzymes that are in the skin that help to fight off infections as well. We're slightly acidic. We have an acidic mantle, it's called, on the skin that helps to fight off infection. Also, the lining of the GI tract, genital urinary tract, and respiratory tract. I think the GI tract immune system is very fascinating to me. We have a series of cells that are right there. We have tight junctions between the cells of the GI tract. Those are two things that can go wrong with leaky gut. That's kind of a buzzword right now. We have mucus in the respiratory tract. We have cilia, which are those hair-like cells on the top of cells that push stuff back up and will digest it. And we could kill those things off better in the GI tract because of the acidity of the stomach. That's another first line of defense, acidity of the stomach, coughing, sneezing. We can expel things through urination. Vomiting is a response. We have receptors, chemoreceptors, right in the midbrain that actually are exposed to the blood. It's one of the very few areas that are exposed to the blood in the nervous system that can sense if we have, for example, eaten food poisoning. And we have, unfortunately, the vomiting response. Fortunate because we get rid of it. Unfortunate because who likes to throw up? First line of defense. Okay, we also have enzymes that are in saliva or tears. Earwax is just sticky. We have some enzymes in sweat and our mucus. Those lysosomes, remember those little package of enzymes that we have in cells, can attack bacteria and antimicrobial peptides that are in the sweat we excrete, the surface of our skin, and along those surfaces of the GI tract can help to fight things off as well. Normal microbiome is something that is in, if you're into scientific research about health, that's a big thing. And we've become too clean. And I'm totally guilty of it because I'm always wanting to wash my hands. We need a little bit of those bacteria to come in to help us to fight off infections. So, some of the things that our normal microbiome does is builds up good bacteria. And so we have that in order to fight off the bad bacteria. And obviously, we like this good bacteria, okay? Helps also to have enzymes with our digestion, to have the appropriate amount of breakdown of macronutrients so we can digest those foodstuffs. If we have a proper microbiome, we can synthesize metabolites, we can break down substances appropriately, we can release antibacterial substances, like I said, on the surfaces of our body, and it'll fight off pathogens. It'll also help to build up our adaptive immunity and communicate between the brain and the GI tract. This is a big research area when you're talking about irritable bowel. So that your microbiome gets off you're sending the wrong signals to the brain is stressed, it sends the wrong signals to the GI tract. You've got to have both functioning properly in order to have a good, healthy gut and microbiome. Okay, second line of defense with inflammation in this first line of defense, innate immunity, will happen in vascularized tissues. Very quick, it's non-specific, adaptive will be specific, and you'll have cellular and chemical components. So, vascular response of inflammation. So if you can imagine the tissue has, so here's the surface of the skin. Ouch, I cut myself. You're going to have a ton of capillaries in that area. And the vascular response with all the chemicals that are released will open up spaces between the cells of the blood vessels. So if this is a cross section of a blood vessel, capillaries are made up of what are called simple squamous. We have these simple squamous cells here. And the inflammatory chemicals will open up little spaces so we can get white blood cells out of the bloodstream and into the tissues. This is the vascular permeability and leakage. This is not permanent, this is temporary. White blood cells will adhere to the inner wall of those blood vessels and then sneak out. And you get your typical manifestations of tissue damage, redness, heat, swelling, pain, and loss of function. This helps to prevent and limit infection, further damage, limit and control the inflammatory process, so it's an adequate amount. And an example of inadequate inflammatory would be like a rheumatoid, where your body's not creating the appropriate inflammatory response. It helps to prepare that tissue for healing and repair, and then it'll start to send signals to the adaptive immune system, which we will study in the next set of notes. Now, there are proteins in the blood that are released and activated when we have injury. And this is a complement system which kicks into play clotting and kinin system. Kinin system is a series of proteins that are released during injury to help promote the healing process. There are proteins and enzymes that begin what's called a cascade of responses. Okay. Now, the complement system, it's a very potent and kind of interesting system. There's different pathways you could see below. We're going to be talking primarily about this classical pathway. This gets into a little bit more complicated pathways, okay? And it's an activation of C3 and C5, which are these anaphylaxetones, okay? And these are proteins in the bloodstream which start to send signals out into the body saying, bring inflammatory fighting chemicals and cells here. And that process is called chemotaxis, the bringing of those inflammatory response defenders to them. And the opsonins are the actual signaling chemicals themselves. Okay, so that's the general gist of this complement system. You need to clot, right? You're going to have to form a clot if you have an open wound. So you've got fibrin strands in place and platelets. And these fibrin strands kind of create a meshwork in which the platelets can embed themselves. It'll start to prevent the spread infection. It'll also stop bleeding. It localizes infections. And it also starts to form the framework for repair and healing, which we're going to go through those steps in just a second. Two different pathways, extrinsic and intrinsic, will happen locally. Contact activation between the cells themselves. Tissue factor is an extrinsic pathway, which sends signals to send more chemicals there to help that clotting system. Okay, kinin system. is substances, bradykinin may sound familiar, in the blood, which helps this whole process. You could see it causes dilation of blood vessels, it causes pain, so we know to protect that area, smooth muscle contraction, and increase vascular permeability. So with the dilation of blood vessels versus smooth muscle, because it's smooth muscles that are around the blood vessels, you open up the blood vessels that are right in that area to allow more of these factors to get out into the tissue to fight off infection, but you're also going to close off outside of that area with smooth muscles so the infection doesn't spread. I think this is pretty self-explanatory, kind of summing up the plasma protein system. There are cellular components we're going to go over that give that response. There's also cell surface receptors that help to signal these pathways. I'm not too sure how much. Oh, okay. So these are receptors on the surface of the cells that signal the area of damage. They're pattern recognition receptors that can tell us whether it's a pathogen or damage. You know, and a pathogen would be an infectious agent that has come in, a virus, etc. Damage has been a cut or something like that. And these cell surface receptors, and we spoke about the surface of cells previously. Don't forget, we have the cell with a phospholipid bilayer, and then we have all these protein receptors that have many functions. And then we also have what's called the slimy layer. It's actually like glycocalyx on the surface of the cell. Okay, and so you've got these receptors on the surface of the cell that can tell if it's a pathogen or if it's been damaged. And these are, you can look these up on your own. They all have different functions. They're different receptors on the surface. Complement, we'll start that complement cascade. Complement cascade is an inflammatory cascade we talked about briefly earlier, and then scavengers for infectious agents. Cytokines are locally released chemicals that are released from cells that are damaged that can do a multitude of things. They are chemotoxic. We spoke about that process that will attract leukocytes. Okay, a leukocyte is a generalized term for a white blood cell. A lymphocyte is a specific leukocyte. So make sure you kind of note that difference. We're going to go through the different white blood cells in just a minute. But several of my students always get that confused. So just make note. Okay, and then chemokines are also released by multiple cells that are in the area. And in the area where damage has happened, we tend to have macrophages, which are always up in the tissues, kind of eating things up. Fibroblasts, which create fibers in tissues, and endothelial cells line the blood vessels throughout the body. Okay, 50 different chemokines. You can see there are many different types of them. We are going to talk about a few of them. So interleukins attract macrophages and lymphocytes. I'm going to kind of go through this. These cytokines are, once again, kind of tough because they're just memorization. You've got to just memorize what they are, what they do. Okay? So I'm going to kind of blow through these because I think it makes sense. You understand that these are different substances released by cells throughout the body. These are the different types and their functions. So interleukins produced by macrophages and lymphocytes in response to those proteins that are telling us there's damage in the body. Okay, alter behavior of cells. They will attract leukocytes. They'll induce proliferate and mature leukocytes, enhance or suppress inflammation and the adaptive immune response. Pro-inflammatory cytokines. So these are substances that will increase inflammation. You can read through them on your own and their functions. Anti-inflammatory cytokines. We also have anti-inflammatory ones. And within the body, as I mentioned before, like with RA, inflammation goes awry. I'm not sure, don't do research on it, but maybe they have some issues with these anti-inflammatory cytokines. We need to be able to buffer that inflammatory response because we don't want it to keep going. If it kept going, it could cause problems in the future. Okay, so memorize those and what they do. Interferons, another chemical, type 1, type 2, you can read through those on your own, protect against viral infections. Okay. Mast cells, we will talk about these. Mast cells are located in the tissues of the body. They're a huge activator inflammatory response, especially the release of histamine. Okay, so that's a big one. We all know what histamine does. Histamine is that chemical which perpetuates our, I'm rubbing my eyes today, literally, our responses to allergens in the area. Mast cells are a huge contributor of this, so we take antihistamines, which decrease histamine that are released by these mast cells. And they degranulate, so they have little areas of collections within the cell itself that can be released, and you could cause immediate effect. There's other substances that are located in these mast cells you can see. Histamine is a big one. They have chemotactic factors, which will, don't forget, chemotaxis draws those inflammatory fighters to that area. It will actually draw neutrophils and eosinophils. Those are both white blood cells. We'll talk about in just a little bit. Arachidonic acid, which is actually going to promote vascular pain and affects bronchodilation. Okay. And platelet activating factor, which will affect that platelet activation. Okay, so these little guys have a lot of functions. Okay, so we went through this. You can look at the effects of histamine. I think all those pretty much make sense. Now, as a sidebar, we have H1 and H2 receptors. You guys probably know about this because of medications, but histamine will have different effects on different receptors. That is true of any chemicals and or hormones in the body. An H1 receptor will be pro-inflammatory and H2 receptor will be anti-inflammatory. So it'll have different effects on different tissues in the body. And we spoke about these chemotactic factors drawing those inflammatory molecules to that area. So these are also locally acting substances that are released as a response to injury and or infectious agents. Leukotrienes are similar to histamine, but in later stages, and I believe you could find these in the lungs when someone is having, say, an asthma attack or overreactive asthma. And also eosinophils, I believe, can have an effect with the asthma as well. Prostaglandins are similar to leukotrienes. They can also induce pain. So this is where aspirin and NSAIDs work. They block the synthesis of prostaglandins, which inhibit inflammation and pain. Platelet activating factor is similar to leukotrienes in platelet activation, activating those platelets in an area of damage so we can block it off, so hopefully infection doesn't spread and we can stop bleeding. Endothelial cells, we looked at the inside of capillaries. Those are simple squamous cells, which are just kind of egg-shaped cells that line the inside of the entire cardiovascular system. So they're the ones that you can get white blood cells sneaking through, okay? But also, if you get damage to them, you will initiate activating platelets. They will block up the damage so we don't have bleeding come out. Leukocytes will come there and fight off the damage with those white blood cells, and then we will also promote wound healing, okay? Now, what happens to damage to tissue outside of those cells is if you have a cut in that area, those squamous cells shrink a little bit. You start to send out the white blood cells to that area. You'll send out the platelet activating factor, and also mechanisms to start the wound healing will sneak on through those endothelial cells. Keep in mind, and I spoke about the endothelial cells themselves getting damaged. That is the beginning of hardened blood vessels and atherosclerosis. So on the lining of all blood vessels, capillaries, arteries, venules, this is a little sidebar, can't help myself, sorry. We have what are called squamous cells. And keep in mind, there's millions of them. And they are cells with nuclei. And we spoke about them shrinking a little bit so we can get all of these inflammatory mediators sneaking out. But also keep in mind that these can get damaged. They can start to attract plaque and fats that oxidize. And we can actually get to the point where we can have plaquing go across that blood vessel. Imagine that's all filled in with fats. And then we have a little clot, close that area off, and boom, that is now an ischemic area. Beyond that, okay, so just as a little sidebar. Platelets lead to coagulation to stop the bleeding. We talked about fibrin, those fibers crisscrossing and the platelets plugging it up as well. Degranulation. So degranulation is a release of substances from the inside of cells. They have serotonin in them. I think the biggest thing to remember with platelets right now is that they're in the blood waiting to block up areas that we have tissue damage. Okay. Neutrophils, also known as PMNs, because they have multiple kind of lobules off of the nucleus itself. They can act as phagocytes. They can eat things up. The primary thing to remember with them is they ingest bacteria, and they can also eat up dead cells in the body. These are short-lived. They'll break down. We create new ones. We're going to look at exudate in just a minute. There's different types of exudate, which is fluids in the body. We'll talk about those in just a minute. Eosinophils also have mild phagocytic responses. They defend against parasites and also help with the regulation of vascular mediators. Basophils. Okay, these release histamine, which we spoke about before, and we will have that in response to allergens. Monocytes will turn into macrophages. That's what you need to remember with these. And they go out in the tissues to eat up infectious agents, to eat up dead cells. In this response, when we're talking about immune responses and also healing tissues, they help to remodel that tissue by eating up the dead cells. Dendritic cells interact with T lymphocytes to generate an immune response. It's about as much as you need to know for that one. Lymphocytes, okay, these activate macrophages, but also please note that these are seen in higher amounts with viral infections. So neutrophils you'll see more with bacterial, these you'll see with viral. Natural killer cells are a type of lymphocyte. We're going to look at other types of lymphocytes in the near future. These will deal, oh, it does have virus there, sorry, I didn't realize. Okay, there's natural killer cells there, but you should know viral with lymphocytes, period. And it also helps to fight off cancer. Inhibitory and activating receptors allow these cells to differentiate between normal and abnormal cells. So let me explain that to you really quickly. Oh, let me just finish this up. It produces cytokines and toxic molecules to destroy those infectious agents. Quick little overview with your immune system. So when you are young and your immune system is building, there are cells that actually go out into your tissues and your bloodstream and kind of make note of what is your tissue and what isn't. And I find that fascinating. And so over time, your body learns its own tissue. And so therefore, if you have something invade your body, viruses, bacteria, etc., your body knows to fight it off. So these natural killer cells know what is our tissue and what isn't, and what needs to be destroyed and what doesn't. Totally fascinating concept to me. Phagocytosis, you ingest, you get rid of things that you don't need, primarily seen in neutrophils and macrophages. They will adhere, once again, kind of this common factor. We have these neutrophils and macrophages in the bloodstream, okay? They will pavement, which means adhesing to this marginal border of the blood vessel, marginate to the periphery, and then kind of wiggle their way through those endothelial cells, which are those squamous cells on the inside of the blood vessels, and then they could get out into the tissues. Here's a little picture of that process. Bringing in substances. Okay, so the opsonization is the chemical marking of substances that are foreign. They are marked. These phagocytes come in, could be a neutrophil as well, and it says, hey, we need to engulf this. It brings it to the edge. Pseudopod is just an out pocketing of this cell. It engulfs it. It then uses enzymes to break it down, and then it will, and here are the lysosome pockets with those enzymes to get rid of that substance. Okay. A, B is antibodies. We'll look at that. Okay. So antibodies that have marked an antigen, we'll get into that. That's when we get into the next set of notes. Okay. So phagocytosis, you recognize it, you adhere that abnormal substance, you engulf it, you create what's called a phagosome, which is this little pocket that has not only the ingested agent, but also the enzymes from the lysosomes to destroy that little sucker and eat it up and break it down. Okay. Acute and chronic inflammation. Acute is self-limiting. You've hurt yourself, you sprained your ankle, in 8 to 10 days you feel better. Sometimes things can become chronic, like chronic low back pain. So if the treatment does not rectify the acute phase, it'll become chronic. This is why it's important to take care of things before they're around too long. Your body almost gets into a habit. If you break that habit, you have more of a chance of it not becoming a chronic issue. Okay. I think we've talked about these first couple of phrases here, but here is exudate. So exudative fluids will be fluids that will be excreted in an area where there's been damage. So you can have a watery fluid if we don't have much infectious agent. If you have something more like an irritation, you can have a serous or a watery fluid. Serous fluids are also secreted on the inside of the body, as opposed to mucus membranes, which have more mucus in it that are exposed to the external environment. We have more mucus in those fluids as a normal basis just to trap things. We don't ingest them. Fibrinous exudate is going to be thick and clotted. It'll have those fibers in it and some platelets. Purulent will have pus. Hemorrhagic will have erythrocytes. So know the difference between those fluids. Systemic manifestations of acute inflammation. I think that's all pretty self-explanatory, and or we have already spoken about it. All right, so let's read every word of this. An injury to a vascularized tissue. Because keep in mind, we have non-vascularized tissue such as cartilage. Cartilage cannot be repaired because it's not vascularized. The level of vascularization, if you can say that, will determine how much that tissue can be or cannot be repaired. Okay, so we're talking about a tissue that has vascularity to it. So we have injury to it, and it's activated in an acute and a inflammatory response. Which of the following is true regarding the response? Okay, is non-specific. Well, thinking back, did we talk about anything that is specific? Well, yeah, we did. But we didn't say, with this injury, you're going to have only this, process. So let's read through the rest of them. So that's a possibility. Is activated slowly. If you think about injuries that you have seen and or had, these immediate responses are activated quickly. Is the third line of defense. This whole lecture is based upon it being the first line of defense. Okay, there's different phases and steps, but this is considered first line of defense and relies on cell components only. Well, if you think, yes, we spoke about cells, we also spoke about proteins and chemicals. Okay, so there you go. These responses are non-specific. It's activated quickly. Okay, second line of defense. I've always called this a first line of defense, but okay. Second line of defense, and it relies on chemicals as well as cells. So we spoke about this chronic inflammation. If you don't rectify acute, can become chronic and it can continue. Here's some characteristics. Intense infiltration of lymphocytes and macrophages. Granuloma is tissue that is moving towards healing but not healed. Epithelioid cell formation and giant cell formation are other characteristics of chronic inflammation. Now, on the other hand, with normal wound healing, we can have regeneration of that tissue if it has a proper amount of blood supply. And it returns it to fairly close to its original structure, but not completely. We may have a scar, for example. Repair is going to replace the destroyed tissue with a scar tissue, and you could have scar tissue left over. Okay, so these are different. I see what they're explaining here. I'm sorry, I thought they were going through different phases. They're going through different types. And I think we somewhat cross over a little bit. Okay, so regeneration's regenerating that tissue. Resolution, returning it back to its original. Repair will have a scar tissue. That's what they're getting at with these notes. Scar tissue is going to have primarily collagen. It'll return that integrity. It may not be fully healed, and it may not look like the original tissue. Now, primary versus secondary, you probably know this. Primary, there was minimal tissue loss quite often. With secondary, you'll have to have some sort of suture or repair with that. Phases of wound healing will have that coagulation. A clot will form with those fibrin strands and platelets. Increased capillarity, permeability, so substances can come out, and growth factors are substances in the blood that help promote this wound healing. Inflammation, macrophages come in to eat stuff up. Mast cells release those histamine substances to open up blood vessels. Neutrophils and lymphocytes come in to fight off bacteria and viruses. And then the goal, if we have proper wound healing, is for new tissue formation. That wound will seal, a clot will happen, eventually you'll get a scar. Macrophages eat up the dead stuff. Growth factors help creation of new tissue, as well as a creation of new blood vessels, which is known as angiogenesis. Fibroblasts come in, those help to create new fibers in the area. They can regenerate or repair. Lesion, of course, is a generalized term for an injury. Granulation is a creation of new tissue that starts to look like the old tissue. Epithelialization is the creation of more cells on the top of that tissue. You have epithelial cells on the top of your skin, for example. Remodeling and maturation, it keeps working its way towards the original tissue, looking more and more like that, although some scar tissue most likely will be left behind. And this is a visualization of those phases. So dysfunctional wound healing, wounds don't always heal. You could have ischemia, which is loss of blood supply to the area. Excessive bleeding would have to be taken care of course. If somebody has excessive bleeding due to genetic issues with bleeding or having a wound that's too large. Excessive fibrin deposition, we'll look at keloids in just a slide or two when you get an overproduction of those fibers and the scar tissue grows beyond the original injury. Okay. Obesity, diabetes can help limit the ability of a wound to heal. As you guys know, we have several diabetics in our family and their ability to heal is very decreased. That's because their blood vessels on a very microscopic level get damaged. You just simply don't get blood to the area that you would get otherwise. Infection, if an infection settles in an area, it will not heal appropriately. Inadequate nutrients, collagen helps, vitamin C helps, zinc helps. So if someone's not eating proper nutrients, they cannot heal as well. Protein is important for healing of wounds. Some medications can interfere, and of course smoking can interfere with proper healing. Keloid is dysfunctional collagen synthesis. If I were to take out a little chunk of your skin and look at the dermis, which is the middle layer of it, it has a lot of nice interacting, overlapping collagen fibers. And with keloids, there's an overproduction of that. Hypertrophic scar is an overreactive scar where you're going to have an over deposition of that collagen as well. Wound disruption, if somebody pulls the wound apart, that unfortunately does happen, and that will increase the risk of infection. You guys could probably tuck circles around me with that. I'm sure you've seen and dealt with that. And then contracture. And, some of the proper wound healing will be how the scar runs as well. There are certain directions that collagen fibers run in the skin that plastic surgeons know very, very well. And if it's across those fibers, it won't heal as well, as a little sidebar. Okay, there's an example of keloid and dysfunctional wounds. Okay, keloid is on the right. I'm looking at that poor scar on the left, and that is healing. That looks like it's not getting epithelial cells on top of it. So that brings us to the end of this section. If you have any questions, please let me know. Have a great day.